In our modern healthcare system, medications often accumulate gradually, sometimes without us even realizing it. Joining us to address this concerning trend, known as polypharmacy, is Dr. J.P. Saleeby, Medical Director for Carolina Holistic Medicine. Dr. Saleeby, thank you for joining us today.
Good to be here.
So polypharmacy, can you give us an overview of what that is?
Yeah, so it's all in the word, the definition. Poly means multi, pharmacy, pharmaceuticals. So it's usually seen more prominently in our older folks, people in their 5th, 6th decade of life. They sort of accumulate medications, whether it's blood pressure medications or things for cholesterol or for pain. And there are drug-drug interactions. You get beyond 2 or 3, and it's very hard to see how those medications interact with each other because they're synthetic, and our body's not really used to knowing how to process those in the liver. So usually in my view, and that may differ from other practitioners, if there's 3 or more medications, that's polypharmacy. Not only limited to pharmaceuticals, but nutraceuticals, which are dietary supplements.
Really?
People can go crazy on that, and they can accumulate 12, 15 different pills, vitamins, supplements, things like that.
Yeah.
So,
are there any well-known drugs that maybe prescribed together or people are taking together that don't interact well that you've seen?
yeah, so there are some drugs that have an effect on, let's say, CoQ10 depleters, so drugs that will deplete coenzyme Q10. Statins are probably number 1. Bisphosphonates, which are used to treat osteoporosis, probably a second. So if a person is on a statin drug and a bisphosphonate, it can really deplete their CoQ10, which is very important for the mitochondria, so they can get in trouble with that.
Yeah, and so obviously, you said that this is seen more in the elder generation. Other reasons, other than them being treated for illnesses, what are some of the other reasons that these pharmacies or doctors may be prescribing them so much medication?
Right. So in Western medicine, it's very easy to prescribe a pill for somebody. And if people have multiple specialists, they see cardiology, nephrology, rheumatology, they sort of accumulate. And if they don't have a primary care doctor to kind of monitor all that, that can build up really fast. Another danger is they may get Ventolin from their pulmonologist and albuterol from their family practice. Same drug, different name. So now they're on 2 of the same things. That could be confusing.
And now, what are some ways for us to reduce a pill burden? Yeah,
so you need to find one primary care doctor that's adept at reducing the pill burden, reducing or deprescribing, which can be tough because it's easy to put somebody on something, but it's sometimes difficult to take it away because you don't want to put the patient at harm. But and there are some natural alternatives to some of the pharmaceuticals. For instance, magnesium glyphosate, for instance, or glycinate, or magnesium malate might be a good alternative to a calcium channel blocker for blood pressure. And there are many, many other examples.
Yeah, and now you mentioned earlier that this can also happen with dietary supplements, and that is a little bit more frightening because it's over the counter. We can go and purchase these ourselves, and there's really no regulations. What are some of the big ones that you see that people are misusing?
Well, there are some that are over the counter that I don't like. They're over the counter. DHEA, for instance, it's a steroid hormone. It is over the counter, and people can get in trouble with taking too much. Women especially, if they go north of 10 milligrams per day. And then they can put that in combination with other things. A lot of times they'll read something fantastic about a particular supplement like resveratrol, which might be good for anti-aging. And they may pair that up or continue to collect. Every time they read a new article, they're collecting another supplement. So they should have someone knowledgeable that can say, well, this is not necessary, let's take this away.
Okay, like Dr. Saleeby.
Yes.
Now, where can our viewers go to learn more information about this issue and also about your practice?
CarolinaHolisticMedicine.com, and we have an 800 number, 800-965-8482.
Wonderful. Thank you so much, Dr. Saleeby.
Yeah, good to be here.
We're back in 2 minutes.